what's up? Let me get everything set up real quick and then we'll start on some stuff. Oh, where's that other piece that I had? Where did I put that last piece at? 1 second then. Okay. Let me turn the light on too. Alright. Where does this get plugged into? Boop, boop, boop. There it is. And then let's go back over here and change this. ROG. This looks really bright. Why does this all look funny? It's like super washed out. $720. Yeah, this looks kind of weird. Everything's like way too bright. Oh. Huh. Let me try something. Let me try to get this going. Hey, what's up, Jamie? See, why is my display settings acting all weird? Do I need to restart my system? Let me just restart that real quick. Oh, and where is my other piece? Oh, that's right. It's just starting. And we can do that. I said it wanted me to have a sore throat today. Ain't that crazy, too? How the tooth charms go. They, So yeah, that's right, because you were here for that one yesterday. Um, I poured it up and I put it in the pressure pot. Checked on it in the morning, and they look nice. But because I didn't put a separating agent, I didn't put something that would prevent it from sticking to my other material, it's pretty much just stuck on there. So with that, now I know that, for one, I need to apply a separating agent. Easy thing would be like Vaseline or some of this tinfoil substitute that I have. And once I do that, I'm going to give another pour tonight, probably off stream once I'm done with here, because I'll just mix up a set and just pour it in. And then I'll see how that looks in the morning. But the way that they look is actually not too bad. Actually, let me go grab them real quick, because I have them. They're just in their little pieces. So, as far as how they kind of look and everything, of course, this is the hard suck down plastic that I was using yesterday. But they look like freaking popsicles, which is cute on its own. Kind of makes me think to make some molds like this so I can just make it popsicle like. But pressure potting them and everything, looking like deep into them through like a light and everything, I see very minimal bubbles, which is perfect because that's what the pressure pot was supposed to do. And I only see like one around the edge on this one, and like 3 dispersed on the edges over here on the other side too. So I like the results, especially with the red, because it's a little bit translucent, a little bit transparent. You have a little bit see-through on it. That's fine. And even the whites, like the white one that I made, I really don't see any bubbles in there, but it's a lot more opaque. What if you come like that one of the users who melts down giant gummies and then uses molds to shape it differently? Oh, I totally could do stuff like that, right? I can totally see that working out and working out. I can totally see me doing something like that too. But as I start playing around with this more, I can see that happening. One of the things that I'm kind of wondering about, because I think this says it is supposed to have like, yes, we are playing. I am gonna throw the Minecraft thing today. I know it's been a little bit, right? You're like, hold on, Minecraft? Let me make sure I have my Bluetooth on. Also, there we go. Come on, connect. There it goes. Oh, need to restart it real quick. But yeah, like I was mentioning, it supposedly has an 8-hour cure time for that resin, which is okay. And I think with it, it'll work just fine. With these, I think when I pressure potted them, especially because in the pressure pot I had water in there, it kind of kept it really moist with inside that container, which didn't help with the setting time on this. But I mean, they're firm. They're just firmly like cemented in a way to the little to their mold. So I'm gonna use, instead of the hard plastic one, I want to use my softer one that I can kind of bend and crease it out. Also with the addition of a separating agent to help. Oh, that's right. I need to throw headphones on, and I also need to change a lot of my settings, because I'm not only doing dental Q&A, we're also doing blocks. So I think this is what I ended up doing before. If I painted my teeth blue, would I be able to hook them up to my phone? The main thing about that is how often are you connecting your teeth to the blue phase of their life. It's so funny, the use of the use of the word Bluetooth, and that they find jokes like that to be able to use, especially like in dental, because you can get like dental crowns that are blue, that's tinted or colored blue, and then we just call that Bluetooth. Even at one point when I had to make a temporary for myself because I had a root canal in a tooth, I went and dyed that temporary crown blue and had that running joke of I got a Bluetooth. Yeah, something just us dental nerds just do quite frequently, right? Is try to find our jokes whenever as often as we can. Let's see. I need to change up something. I actually need to save this over here. Oh, my session expired. It's alright. I'll apply to that thing a little bit more tomorrow. Turn that down. Bring that down. I want to switch over to. You definitely should walk into the portal. What portal? Actually, when the hell did this portal get here? I don't remember this being here. Who built? I was gonna say who built this. Like I know who built this at that point. What's on the? Hold on. I was gonna say what is on the other side, but let me go drop off some things into the community chest, because for some reason I have all these things. It's a very hellish place. I need a larger box for my stuff. I know there's a chest over here though. Oh, this chest is kind of used to. I think we got quite a few fishing rods, so we'll be fine. I'll keep my bow. I'll keep this. Okay, the community chest should be used for purely items that would be helpful to others. Oh, that is true. I am actually breaking the rules of the community chest on what would be there. Let me take out this Dirte. I think we actually have a bin underneath here that's for what was it called? Where's the cave entrance? There it is. For a couple furnace things. Actually, that's right, Cora went and put a bunch of chests over here too. I was right, she put like a bunch of netherite armor and diamond armor and stuff up here. Okay. How are all these guys doing? They're doing just fine. Am I running at 15? I'm not. For some reason, every time I open a micro, I change the volume on it to the I have to change the volume of it on the volume mix. Oh, I feel you. It goes back to like not setting the sound the right direction. Oh, the alloy's over here. Alloy, whatever it's called. Oh, is nighttime coming? Nighttime is about to be here. Let me go and get ready for bed so we can skip that hellscape. And then while I'm getting this ready, I'm gonna go and switch up. Look at I was just about to go and check it out. You already read my mind. Yeah, I was about to go and change that. And let me look at the Twitch. And then it's a block. That's funny. Always has been. That's so funny. And let me go switch up YouTube's side of it all too. I like that one though. I need to change the live. Anyways, I'm on the Minecraft. You should be in here pretty soon then. If you want to join, I mean, that's completely optional also. I just need to get better at the Minecraft techniques. Super lacking. Cool. Alright. Block mentioned. Time to send every block emote. That's funny. Is that like a specific through someone specifically? Twitch Global? Oh, okay. That's a crazy one. Let me see if I can get this switched up. There it goes. I think you still have to invite people. Nah, really? I thought I said it so that it's a friends, and you're on my friends list, no? Yeah, you're up there. See if that went your way. There you are. Hey, look at you, Watermelon Man. That's a cool one. What do you have? Oh, eating? Yeah, you're actually right. I do need to probably get some snack on. Oh, is it raw cod? Maybe we should double check the settings. Oh yeah, I'll definitely check those out here in a second. Especially if the other students, especially if any of my students want to hop on too. Try to kill me. What is he doing? Why are you sitting under there? Do you have unlimited breathing potential? Friends. Oh, there you go. Oh, I do have some cooked ones. Cool. I'm gonna go and do some fishing, see if I can get anything lucky. Is there anything to do over there in the portal? In that hellscape that you were talking about? Actually, I should start making sure I have what's it called? Armor too, so I can start living through some of these fights and battles. Let me see if I can get these two nerds to join in. Mine for netherite, fight mobs in a tower, might need to get stronger for this one, or find a bastion. Oh, mine for netherite. Okay, I get you. Which is yeah, let's get stuff like that going. Luckily, skin packs in Minecraft don't cost much. You should be. So should I get the Star Wars skin? Yeah, that's right. They do have a lot of neat skins. My kid has a neat amount of skin packs that she always wants me to get her, or the Minecraft worlds, and they're pretty fun. when she puts them on and she's like, "Okay, Pa, you're gonna play Minecraft with me." I'm like, "Okay." Throw up that Disneyland world. It's super fun to play. And then she gets all the skins along inside of that pack, and it's super neat. Got him. What went poof over there? But they have so many Star Wars skin packs. Oh, they don't have like a major one that they use to they don't have a major one that they use as like a bundle. I'm pretty sure there's many bundle packs. They're probably selling them in like episode 1 and episode 3. Yeah, I guess that's why I have like 2 weird skins, whatever the one I have right now, and then the ones that came in the SpongeBob version. Pretty sure this water is too shallow to get anything. I'm just gonna get the one that's the best. I wonder which one's the best one now. What's this? Ink? It was funny, my students were telling me about when they killed the, what was it called, Pillager or whatever, the one with the flag on them. Because I finally got to talk to them and be like, what did you guys do? And they're like, we killed the little pig village one with the flag, and then we saw you got the omen. And she said that it had like a 90-minute timer of them being raided or something. So they were like, we had like 17 minutes of just straight battling that was happening. I was just laughing at them describing the war that they went through. One day when I'm able to find one, you need to kind of see that whole situation. What is it called? Yeah, the bad omen or whatever. Clever. Let's see, what else do I have? Oh, this should be up. I should be up at like 10 decibels. There we go. I can bring this down a slight bit. Who shot Hans or Greedo? Isn't it the controversial thing to say that Hans shot first? You changed your skin. Oh man, you are quick. Let me see. Teleport who? Me to you. That is cool. You need to see it. That is so cool. you just have the thing off on the side. Does it just eat like normal? That's so funny. You truly did pick the best skin. That's so cool. Yeah, because I don't think was my skins that I have. That was just a random one. How do I do this? Character creator? No. Emotes Cape Marketplace. My characters. Yoda. That's funny. Yoda works correct, but not R2D2. Oh, because of, like the arm movements and everything. I guess R2D2 would have just like a small little Small little extendo arm that would come out of the body. Oh, this looks good. Yeah, this looks actually really good. Oh, what the hell is that guy doing out there? Looks like he wants to get himself killed. Oh, I didn't mean to do that. Don't tell him that I broke the glass. I wonder where the cryptobite is. Oh, I'm pretty sure he'll show up here not too long. Once he wakes up at his respective 1 o'clock in the morning, like he usually does, he'll be around. I know this is doing like no damage, but it's just funny as hell. Are you fighting something out there? Oh, you are. Oh, I want to see that. That is hilarious. Where'd he go? Oh, he must have went around the other side. Oh, he's following us. That's what he's doing. He's over where the cows are. Not the cows. Oh, there's a couple more. Ow. That's fun to see how you're doing that. Is this water just too deep or something? Well, I guess it doesn't have a typical. Hey, who the hell just hit me? I was gonna say, I guess it doesn't have a typical like level to be. Oh, whoa! You look crazy when you're doing your like moves. It almost looks like you're doing flips sometimes. All right, let's go hit this. Let's go hit the sack, and then we'll have daytime come about. Of course, there's a monster nearby. Let's go and. Did he become a drown? Did they change it to drowns, or was this? Yeah, because this was a zombie just a moment ago, wasn't it? Oh, really? Oh, that's crazy. Thank God, just die already. Okay. Alright. Let's hit the head. Talk about more of this tomorrow. We'll do more, do a little more exploration. I'll do some mining, then I'll return that back as I come back later. Oh no, that's what I want to do. Let's go hit that strip mine that you ended up making down there. I thought we had a good amount of what's it called? Of what's it called? Torches. Maybe it's in one of these chests that I ended up putting them in. Okay. He looks so funny. Time to head down again. Oh, actually, that's right. You have a shield. How'd the cow pen even get open? I feel like I should have an answer for you, but I want to blame my students. I feel like I should try to figure out how to change these into actual stairs. Just make stairs and replace them. Yeah, I'll get some of the materials to be able to do that. Once I check out where this mine that you made ends up, because I remember we've seen it way back a while ago when you first got to an end part. I haven't seen it in a bit. This is so long, I don't even know how I did this. You are crazy. You're just built different. Oh, there's a lot of you little sucker fishes right here. You guys just want to get us, don't you? Too bad. I did not mean to point. Oh, you're already over here. Man, you're quick. Oh, you're just slaying over here. You're so short. It's funny. Oh, some slimes over there. Oh, cool. Oh, there's actually opening right there? No way. Oh, but that's a super long fall also on that end. Sand. Oh, and I also liked your little the bad art stuff that you sent. Very different. Oh, oh, it is nighttime. I figured. Wow, that's where our house is. Oh, damn. Wow, that so yeah, we are pretty far. I have no idea where I am right now. You are safe. That's the main thing. Okay, so that's what the hell's hitting me? Get out of here. Scary. Okay. Okay, so my first thing was I want to mark where this exit entrance is. Which now I don't even know where it's located at. Is this it? No. Is this it? Where did I come out at? This is it. Okay. I am just gonna do this for now. Okay. There, I'm in bed. Is it, can we get a panda into the nether? Could you? Did they go like super crazy when they're over there on the other side? Got a baby llama? That's adorable. Ben, self dental care a viable option. Interesting. So, sorry if I didn't get to see you earlier with your question and such. Self dental care viable. If you know what you're doing, I mean, no one's gonna be able to tell you that you can't try to do something on yourself. But you're definitely in better care with under someone that's very trained and knowledgeable, because you can definitely look at people that are like, oh, I got a tooth that I gotta take out. Let me just get a pair of pliers from the garage, grasp onto those little tooth nuggets, and then just whack it out. And in that case, when people especially do like extractions on themselves with normal mechanical with the normal garage tools and everything, they tend to break teeth off rather than actually get the whole piece out on their own. I am not a dentist, but I am a dental assistant, and I've been doing this for 15 years or so, and I teach dental assistants how to do assisting and the whole dental genre for the most part. So very dental knowledgeable, and it's my jam. I like teeth. I like teeth and playing video games, and today's game is just Minecraft at the moment, which I'm terrible at playing. But good question though. There's tons of things online to be able to figure out how to do something. So it doesn't even seem that far off that as we go along, you'll just see more people doing self-care as far as actual true treatment on themselves. But of course, normal oral hygiene instructions and dental education is the more we have out there, the better. I want to do bonding on some of my messed up teeth. Oh, cool. Now this I've been bamboozled, tricked, quite possibly lied to. Jamie, you know what the deal is. I wanted to do bonding on some of my messed up teeth. I feel you. There's situations where people are like, man, if I just didn't have these spots that were visible to the public when I'm smiling or talking or doing anything, it would make me feel a lot better. And a lot of times you're even using the correct word, bonding composites or fillings to the teeth to be able to kind of surface hide the stuff. But as the main detriment that comes to it is if you're not able to actually dig out the tooth decay, the cavities that are embedded into the tooth because of any issues that might be going on there, putting just a lid, or essentially like how I tell my students, essentially is there's a fire going on inside, and inside this tooth, which you can kind of consider your house, just by closing the door doesn't mean the fire's gone, but putting a lid on it doesn't mean that there's not something brewing underneath. So there are people that like what if you did it right after the cleaning? I mean, shoot, if you got a dental cleaning, they're removing all the soft deposits like plaque, and all the harder versions of plaque, we would know that as tartar buildup or calculus. That's just going to make sure that things are just really clean on the surface, and that's cool. But if there's anything that's like tooth decay, that's a dark spot, that's even potentially stains, stains that are a little bit deep due to like either smoking, dark drinks, or anything, could eventually become something larger if they're not taken care of. But I mean, to each their own. There are also different what's it called? There are different like companies out there. I want to say companies, but really they're kind of like mail order dentistry. Whether I think one of them is called like pop-on veneers or pop veneers or something like that. Where they're like, oh, I'm missing a couple of them, or I got some teeth that are broken off. But I don't want to go to the dentist to get everything replaced. I just want something I can pop onto my teeth and it looks like I got them all back, or it looks like all my all my natural tooth structure is now kind of hidden underneath these underneath these like pop-on crowns. And I mean, those crowns are not permanent; they can be popped off and on. So they're not doing any permanent reconstructing of your teeth, and they still allow the patient to go to the dentist and get work done, true work done. But out there's access to all the different materials that a dental office would use. So it's up to you, right? If you do it safely, where it doesn't hurt you, doesn't harm you, doesn't cause you issues, doing something on yourself like that isn't a bad deal. But if you do get yourself into a bind, then it's a little bit tougher to explain to the dentist, yeah, I just tried to do this on myself, and I guess I needed to, it didn't work, or maybe it does work. Excuse me. Okay, I want to go on a trek. I know. Man, damn, we're so high up on this hill. I'm gonna go fish a little bit more. Oh, hey, you didn't have to do that, man. This is why I have this dental advice and questions as a free tool. I love teaching dental and everything, but thank you for the love. Absolutely. As like I mentioned, I'm willing to answer as many questions as you have. If you do have anything that you want to talk about more on or anything, you just let me know. But very much well appreciated. I was gonna say, is this another Canadian? I usually tend to have quite a few Canadians during these live streams at night, also too. But yes, awesome stuff. Oh, where's that? Oh, why am I not able to see the rest of the chat there? I think because I can see the chat over here on the top above me. I think it says Alberta. Yeah. No problem. Oh, no, Alberta. Yeah, I wonder why it's not popping up over here on my little side chat screen here. Top chat, live chat. There you go. Oh, there it is. Oh, okay, cool. How hard it would be to apply? The main part when it comes to application on getting the actual composite, the white filling material to actually stick, it depends on, one, how clean can you get the tooth, how dry can you keep it during the application, and usually micro etching. So it wouldn't be like sandblasting your tooth, but using an acid etch, which is a specific percentage phosphoric acid, having it put on your tooth, it'll kind of clean your tooth really thoroughly and make these small little microscopic holes in your tooth, which you won't be able to see, but those small little holes would be somewhere where you can, I'm dying. The small little holes will help with the mechanical adhesion of the material to your tooth. I have a video on, hey, you're over there on my YouTube channel anyways, right? And there it finally showed up. I have a video on my YouTube channel on that I kind of have for my students on composites and how to place them on there. It's not specifically for like people to do it on their own, but you can see the whole process, and I talk through it on steps to placing a filling on the tooth. And it would be under, what video would it be under? It'd be dental or dental fillings, composite fillings or something. It's on my YouTube channel that gives you kind of like two views to be able to see that the action being done. It's one of my kind of not that great videos, but it I think it's like 30 minutes long or 25 minutes long. It's way too long, but you can kind of skip to certain spots where the tooth decay is removed. Now it's mainly etching, bonding, etching, adding a bond, adding the composite resin, and doing that. Alcohol or no alcohol mouthwash? Oh, it's Rasher, right? Good question. It depends on who's the end user. I like alcohol mouthwashes and everything. A lot of people love the burn, and they're like, oh, if it doesn't burn or if it doesn't hurt, then it's not working. Definitely that's not absolutely true, but the alcohol content that would be in mouthwash would be a little bit more geared towards defeating a lot of the bacteria that's growing in our mouth. So I would say if you can handle it, use it. But if you're not able to hold it in your mouth for that 30 seconds or 1 minute, whichever mouthwash is being advertised, you're not getting the full benefit. So since not a lot of people can use like Listerine, the old school ones that would be a alcohol mouthwash, which they do have non-alcohol ones. Crest Pro Health is a nice one that's gentle, that still promotes that whole breath freshening and bactericidal agent. So if people can handle that, awesome, go that way. If not, go the other way. Another thing that tends to be a thing too is if people are actually should I use a tongue scraper? I highly recommend use a tongue scraper if you have access to it. If not, a simple toothbrush, simple toothbrushing of your tongue will do the mechanical cleaning of it. Just the scraper will remove a lot of the layers of the that would be built onto the taste buds. Another thing that you mentioned with the alcohol too is that some people that are alcoholics, people that that have more affinity to be addicted to alcohol, they should stick away from the alcohol mouthwash, because it gives that taste and that addictive sensation that was in normal drinking alcohol would be there in mouthwash alcohol. Why is there a TNT right next to me? But yeah, tongue scrapers are great if you have access to them. It's neat to be able to kind of get that off of your tongue, and I don't want to say smell it, but a lot of people end up doing that. Any tongue scrapers you specifically recommend? Usually, I mean, you can typically find standard ones that would be built onto your toothbrush that would have more of like a I want to say like an umbrella shape. There's nothing that's really specifically better. They have these these long metal ones that you can kind of shape into a U and get really far back there and scrape forward. If you can handle that, sure. If you can't, use anything that you have access to. Shoot, even you already have a tongue scraper that's built into your body, which is your teeth. If you go and just stick your tongue out really far out, press your tongue against your teeth, you'll get as much as you're able to stick out to scrape that part of the tongue. So the part that you're missing, I guess that's where your tongue scraper would do benefits, but scrape it with your teeth, that's your natural built-in tongue scraper if it has that capability. Part of my gum on the front bottom teeth, good. So mandibular mandibular anteriors, right, came off on a flap. Came off in as a flap. My dentist seemed not to be worried about it, but I'm afraid more is gonna come off. How can this be remedied? So, and I'm gonna switch over from this screen to more of a teaching screen that I usually have, which is usually like my classroom screen. Sometimes I'll do this in my dental. But this gives me an opportunity to put some stuff over here on this side, like you're mentioning. Part of your gum is gone or missing right where that gum side is, and usually what they would call that would be dental recession. So recession of gum tissue or gingival tissue, truly. And what I'm reckon that you're kind of referencing in this case would be maybe more. I just saw one right here. And let me bring it up over on this side. Chrome. Okay. And let me bring up specifically the one that I am kind of seeing more of, which is going to be right about there. So in this aspect, which I know I'm kind of hiding myself a little bit too, are we looking at not specifically that it all looks like this, but that the gums are just lower now than they were before? That would usually be like recession in that, and like you said, it just even came off like almost as if it fell off like a flap. Can be something where certain parts and aspects of the gum tissue has just lowered, where its normal natural level of that it should have been at is, let's see, how do I do this? This is my right, so I actually need to flip myself. What would I want to do? Transform, flip horizontal. Oh, there it is. Transform, flip horizontal. Good, now I'm facing the right way. Where usually our gum level would be somewhere about here normally on like the picture that I'm referring to, but to drop down or I should say it should be normally like right about here, but it's dropped down this much. Usually when it comes to gum tissue, it is once you, what the hell do you look like here? Hold on, is this a real person? Is this you? Well, this isn't Jamie. Sorry. This thing just threw me off in this cave. I don't know why he's here. But with recession, once you lose gum, it's really hard it's really hard or expensive to get it replaced / repaired. If you do have recession like this, the best option that you can have is to stop the recession from happening by doing your normal cleanings, your general cleanings out from your hygienist, flossing, brushing consistently. That's the only thing that can stop the drag. But even as you age, even as you get older, more recession will happen, potentially. So it's something that just keeps on going and going and going. The only way to, like I mentioned, stop it or at least get some back is to do some gingival grafting, where they'll take gum tissue from other parts of your mouth and smack it right there and essentially stitch it into place, hoping for it to be accepted, and you'll have some bounce back where you can get more coverage on that spot. It is not always something that works 100%. A lot of times, if whatever you take from one area and put right there, you're probably going to give it probably like 50 to 70% of what that transplant was supposed to give you back, but it's not always a guarantee. And a lot of times, like I was mentioning, if you keep up your oral hygiene, you should be good. It's just kind of on this one tooth. Okay, good. What kind of hellish image are we showing us? It's the nether, Jamie. We're looking at the nether. It was just kind of almost one to think it was from flossing too hard and meth use. When it comes to small spots, especially like at the gum line like that, sometimes you can have some gum tissue that will just kind of come off and just get essentially kind of cut itself, and it could be, especially if it's in one spot. There, like I mentioned, there's not a way to get it back unless we get gum tissue grafting put back into that position. So we just so now we're just going to retain what we have as best as possible. Yeah, flossing can definitely cut the gums, but usually, unless you're kind of like, usually when you're flossing, you're going in and you're kind of scraping up the side of the tooth on one side and the other. You're not typically wrapping around the gum tissue to hopefully cut it off, or so that you're not wrapping around the gum tissue to cut it off. But it definitely feels that way, especially when you tend to floss and you have bleeding. People don't like flossing because they don't like the bleeding that happens, and that is a reason why they would like stop flossing. So we want to keep flossing. We want to make sure that we keep our gums healthy. When you're using your toothbrush, don't use anything higher than soft. So soft and extra soft is your main ones that you're going to want to use. Medium and hard are really bad for your gums and your teeth because they're so rigid, they're so firm, that they are going to wear at your gum tissue even faster, causing more recession. And also with firm, medium, or extra or hard toothbrush bristles, it wears at your tooth's layer, your enamel, your outer surface faster, making it so that you lose it quicker, and over many years to decades, your teeth will get yellow a little bit because the under layer of your outside surface is naturally yellow. That's going to be enamel on the outside, dentin on the inside. And you could potentially have more ditched out areas where recession pulls gum tissue away. This next one I'm about to bring up, which is called dental tooth. I don't want to do attrition. Abrasion. When you get dental abrasion, it's like cutting into the notches of your teeth that are a little bit weaker than the other one. Should I be softer on that part when I'm brushing it so it doesn't heat? Yeah, you can be softer, just more. You can be softer, just a little bit more frequent. So it's kind of like just you're on two ends of the extreme now. So you're gonna use a soft thing for just a longer amount of time. Versus if you were just like, oh, I'm not stepping away from my medium toothbrush, you would use your medium toothbrush just with less strokes. But I recommend overall soft. You can't go wrong with soft or extra soft. Thrasher, you mentioned, isn't the bleeding only because you haven't done it in a while? Exactly. Perfect example is when you are flossing your teeth and everything, and you haven't done it in a while. It essentially is your body. The bleeding from your gums essentially is like a red flag. It's like, hey, I need help here. But specifically, what your body's doing is because all these little toxins, the plaque that turns into tartar buildup, soft that goes into becoming hard, happens there. Your gums are trying to push off the plaque and the tartar buildup by bleeding. It doesn't do a good job. Oh, sorry, Jamie. If I need to go to sleep. It can't push the toxins off of the tooth by bleeding, but it's gonna still try to do its best. So we kind of use it more as just a red flag saying, hey, get your dental cleaning, get your professional cleaning done so that we don't have to deal with periodontal disease, bone loss, gingival gum recession. I use an Oral-B electric toothbrush with sensitivity detection. Oh, so it's kind of like a, if you're doing too much pressure on your tooth, it'll say, hey, you need to back off a little bit. Those are neat, especially with a lot of the different types of toothbrushes these days. They're all like Bluetooth connected to your phone that can tell you, oh yeah, you spent a lot more time over here than over here. And it'll give you like recommendations and tips on how to attack your next oral, your next toothbrushing cycle. So yeah, they're good. Electric toothbrushes are nice. They can be a little bit more kinder to not putting as much pressure because it's spinning so much or reciprocating so much that you don't need as much pressure. You just need it to be more. You just need the frequency of being there more often, which you do get from electric toothbrushes. But I use a manual one myself. I feel like I can control how much pressure, right, and frequency of passes on my tooth, and that's nice. But electric toothbrushes do have a very good track record. Good questions tonight, though. I haven't had dental. I haven't had dental questions in a couple over a couple of live streams I've done in the recent past, except for Jamie, who's over on the Twitch side of everything. Do you think mewing works? Okay, so I this is kind of somewhat a new term that I'm learning on what people are saying it is. Isn't and I'll do a quick little search here in a second just to solidify, but isn't mewing like the act of making a sound within your mouth, and that like helps with your with like your the shape of your jaw or how the muscles of your jaw works? I think that's what it is. I might be totally off the base, but let me go and take a look and see what it truly entails. It's supposed to be a stronger jawline, right? Yeah, that's what I thought that it was intended to do. Mewing, apart from it being like a Pokemon. Mewing claims to be a do-it-yourself facial reconstruction method in which a person presses their tongue to the roof of your mouth to make their jawline look tighter and slimmer. Mewing isn't universally acknowledged in the world of dentistry. I see. Okay. So they're just saying tongue to the hard palate? Okay. Right. Some people just do that. Some people just do that naturally. Okay. So let's talk about it. I'm gonna jump back to my little gaming session portion here. What the hell's going on here? Oh, you trapped him. That's funny. All right. Do you think it's supposed to be a stronger jawline, right? I think it's just putting your tongue to the roof of your mouth. I think it's just. I think I just do that naturally. Yeah. So when it comes to the jawline, right, that's all based on a couple things that are going to be right there, hugging up on the jawline. It's, for one, the natural build of your mandible that is already pretty much set in stone on how it's going to look without any surgical intervention. You're just kind of born and set DNA-wise to be that way. The only other things that can contribute to having that jawline being a little bit more sharper or anything is, one, going to be the fat content that you're going to have as far as layers on your jaw, and also the other one is going to be the muscles that are going to be there also. There's a few muscles that lie within the cheek called like the buccinator, the masseter, the bicularis oris that goes right around the gum, right around your lips, the mentalis that goes right over here to the chin. All of these things are connected are connected mainly to construct different expressions of your face. So if I go and bring back the slant of my the corners of my mouth to make like a smile, that's engaging buccinators, that's engaging some masseter muscles, and those are good. I can actively kind of train those and it'll create creases in my face. But when you go and use your tongue, especially like you mentioned, pushing your tongue up against the roof of your mouth, it can do a couple things. One, you're putting this pressure on the roof of your mouth on bones, and it's been shown if you put pressure on bones and it's consistent and it's constant, you can affect how that bone bone's structure or position looks like. We do it to teeth all the time. Get a couple of these square little brackets, slap them on some teeth, put a wire in between them, and then chain onto them with these elastic rubber bands, and we move teeth that way. You can do somewhat similar things with the jaw. We have things like palatal expanders that you can wear to expand your hard palate, your jaw, your upper jaw, so that we can make room for teeth. And you can do the same thing for the lower, where your jaw can be expanded out, but it's mainly referencing like your jaw, your alveolar bone, the jawbone, that portion that holds the teeth. All this outside stuff is a little bit different. When you're engaging with your tongue to push up against that the roof of your mouth, you're using a lot of glottal muscles that are found at the base of your tongue and different parts that help with the under portion of your chin, where all this flabby tissue is. Can you get that to look a little bit more strengthened? Probably, so that you don't have something that hangs off the bottom a little bit. Only a little bit, though. I'm pretty sure mewing has some changes that it can do, but it's not a magical cure that can get someone to look like a Giga Chad and have this really strong, structured chin. Because they do have all those different things. They have that little ball that goes in your mouth that they say, oh, chew on this and you're going to activate the muscles that are on the side of your chin, which is also not just the masseter and the buccinator muscles, but also the temporal mandibular muscle that goes and creates that headache that people get when they go and clench when they sleep. So that whole chewing action on that ball, whatever the stress ball is, that's not that great for other parts of your body, even though people try to think like, oh yeah, this will strengthen me and get me to look super altered in my look from doing mewing. If you're bonded your teeth on the top, okay, if you bonded your teeth on the top of the cavity or something, would it be catastrophic? Kind of goes back to that whole analogy that I was using earlier. Probably not analogy, to that example that I was using earlier. Think of a tooth as a house, and if there's a fire on the inside of the house and you just close the door, or even think there's mold on the walls and you just paint over it, it doesn't mean that mold all of a sudden just goes away. You're just putting a lid or a cover on top of it. It can still and will usually burn underneath or grow underneath it and go deeper and deeper and deeper. Just because we kind of put like you mentioned, a bonded filling over the top, even though the bacteria that would be there needs food, which now it's covered, needs air, which now it's covered, we would hope that it would stop growing. But because it can kind of make food out of the tooth that it's digging into, it'll just continue to go deeper and deeper until it reaches the center of your tooth, which is called the pulp or the pulpal tissue, essentially the heart of the tooth, and it will kill the tooth that way. I had to get a wisdom tooth extracted because one of them had a cavity in the back of it. Wisdom teeth are really hard to keep clean, and a lot of times the main thing that would happen is if a dentist finds a cavity on a wisdom tooth, it's almost not worth it to fill it and try to save it, because usually if it got a cavity on it already, it more than likely is not going to be too hard to get a cavity on it again. And that's where we say it's more of a hassle to keep on repairing and saving it. So let's go ahead and remove it and save it from having reoccurring visits. It's a hard tooth to work on. It's all the way in the back of your mouth. It's easier to extract it, and a lot of times they're not even functional, where a top wisdom tooth would actually chew against the bottom wisdom tooth. So if it's already missing its buddy, it's got a cavity, it's already difficult, get that sucker out of there if it's not an issue. My chips are mostly on the back teeth, so it's not crazy noticeable, but my tongue also gravitates to it all day. It just sticks on my mind. Something for you, Ben, that you're kind of mentioning is that there is some issues with some of the back teeth and that your tongue just kind of gravitates towards it. And I'm pretty sure you guys have this in your pharmacies too. And also, because I do kind of get quite a few Canadians that come into my chat recently, which is actually pretty cool and funny. they tell me about like, oh, I'm gonna go to the dentist and this and this and so, or or whatever it is. But if you go to your like pharmacies, like we have CVS's and of course like Walmart's and Targets, and you go to their dental section, in that dental section where they would usually sell like toothpaste, floss, toothbrushes, there may be a nice little piece there that's going to be called like Dentech. I'll bring one up here in a second. It's called dental temporary cement, and it's usually like a pharmacy thing. Walmart. I'll put Walmart as an example. Let me bring it up over here on my other one. All right. You can look for stuff like this. Oh, do I have this flip? Let me flip this one. Transform. Flip horizontal. Oh, wrong one. I'm super dumb. Transform. Horizontal. Okay. If you go to like your local, like typical pharmacy or big box store, you may be able to find stuff like this in that dental section. And when you have access to stuff like this, these are one. It says like, oh, if your cap or your dental crown comes off, you can kind of put this in there, fit it on, call a dentist so that you can get the real deal done because it's not temporary. But also it says lost filling and repair. It's a temporary filling material. It's not going to last for a long time, even though it says long lasting. But it also has some beneficial things, especially if your teeth are hurting. This is specifically just a pre-mixed version of what's called intermediate restorative material or zinc oxide eugenol. So it has some eugenol inside of it that's going to help with. Are you just chatting now? You can kind of keep you. We are kind of just chatting at the moment. I'm probably going to run this up until 12 o'clock, and then I'll more than likely call it. So if you want to change it, you can, Ivy. But this stuff, like I mentioned, zinc oxide eugenol, the eugenol portion of it helps with soothing teeth if it's a issue of pain, which I don't believe is something that you have right now. You just want to get things filled up and in. So I would say recommend getting something like this. It's like $3, $5, whatever it is. Get it. You can, once you pick it out, it has a little tool. You can just fill up the spots where the chips are, and then plan on seeing a dentist in the near future so that you can get them permanently restored. Thrasher. I have used like super floss with my permanent retainers, and it's kind of annoying, but then again, it's be more annoying to have to wear a removable retainer. I straight up feel you on that one. Being a dental assistant that likes to do laboratory technician things, I'm able to make stuff like that, like one of these little retainers and everything. This is one of those hard retainers, and I can put them on and wear them and everything, and they're nice. But like you're mentioning, it sucks when you're not wearing it and all of a sudden your teeth are going to be starting to shift, and then there's like no return, so that can be an issue. But yes, those little super flossers essentially is what we call a floss threader. A floss threader. Yeah, these small little hook-like doodads are super handy for not just like not only those bonded lingual retainers, that wire that runs on the bottom of your front teeth. They are great for bridges. They're great for really difficult areas to be able to get access to and to fix up. Ben, how long do you think it would last? Kind of depends on the user experience. I'm pretty sure it would last probably like a month or two, but also if you're really delicate when you're using it, if you're really delicate when you're using it, you should be able to make it last a little bit longer. And of course, you can always get more, reapply. Why is the retainer only on the front 6 and 4 teeth? So, as you're mentioning Thrasher, with that, because more than likely you're thinking bonded lingual retainer. like as an example, and more than likely this is like the style that you have it as, would be kind of more, I'm trying to get like one that's really nice looking or that's really easy to bring up and see. Yeah, these bonded lingual retainers, a lot of times they're just trying to make sure that they're protecting what you believe is the most important thing, which is going to be the front six from crowding and causing an issue with each other. Um, Oh, you take definitely. You take it easy, Ben. Thank you for stopping by. Thank you for your donation and help and everything. It goes towards good causes, right? But hopefully, you're able to get something going on where you can feel comfortable with what you have and get some dental professional help to get things remedied. But you take it easy. Usually, I'll be here with a better voice. For some reason, I'm losing it. I've been doing my lectures all day, so I'm super on the raspy side now. Why is the retainer only on the front six and four teeth? Yeah, it's just a way. They're just trying to make sure that you still have that U-line arch to your mouth. That is what normally everyone wants to aspire to have, and the back teeth are all going to be influenced by, can they push the front six? So if they can't push the front six and dislodge them, they usually like to stay in line and not cause issues. But it's good that you are using that super floss, because the most common thing to happen with these types of materials with a bonded lingual retainer is that underneath, right at the gum line, you'll see calculus buildup or tartar buildup. So I'll throw this one. And so one of these, yeah, this one. It's kind of blurry, but you can see all that tartar being built up on below that gum line, or at the gum line below that bonded lingual retainer. Um, let's see. I do have a tiny gap between my two top teeth. Oh, so like a natural gap, which is for dental people we would call that a diastema, that natural spacing. Cool. I mean, that's a nice characteristic trait that you might have that makes you stand out from in the rest of the crowd. So unless you really want it to be resolved and fixed, it is generally okay to have. But any dentist, any orthodontist, they would love to realign everything that you have. A lot of times it's a funny thing. It's like, you get braces, you get them taken off, you can go to a whole different orthodontist, braces dentist, the very next day, and that braces dentist will say, oh, it looks like you could probably use braces to straighten up a couple things. So it's all based off of really, what was the original dentist's plan? Did they get to the end result with that plan? And that plan is going to be more than likely different from another dentist's plan, and it just goes on and on and on. Never stops, can't stop, won't stop. Okay, there's something going on here. Check title, let me check a look at that. That's funny. I like that. I need to find a way to. How bad is soda for your teeth? Oh, this is one that I'm pretty sure my person over on Twitch could probably answer pretty good, because a lot of his questions are along that same line. How bad is soda for teeth? The main thing that comes about it is how frequent are we attacking our teeth with soda, which has a lot of sugars. That's the main thing that we all know, that's the main issue and cause. But also phosphoric acid. That's going to be that acidic portion of the soda that gives us that burn. But that burn doesn't only just hurt our tissues, but it also damages our teeth along with the addition of sugars. So it mainly comes down to how frequently are you taking it in. Also, how much of an imbalance in your mouth are you dealing? Are you introducing soda? So in a lot of cases, if you are just that's why I can't sleep here is because he's right next to me. When it comes to how often are you introducing it to your mouth, um, the more the more frequent not imbalance, the more frequent that you are not keeping your mouth at a balanced level, the more often your teeth are going to erode. That means that they're going to have chemical erosion or wear away in a chemical manner, and that's can be an issue that is a little bit harder for some people than others. So a lot of times, as a way to kind of beat it out, would be like, oh, drink soda, and then like when you're truly done and you're like, okay, I'm finally done drinking soda, drink water and actually either drink it or just swish water in your mouth and spit it out, and so that you can naturally rebalance yourself to not be super acidic as far as your pH balance in your mouth. Should I be self-conscious of yellow teeth, or is it natural? It's more natural to some people than others. But some of the more yellower teeth that people have are going to be their vampire teeth, their canines. They're thicker, and the enamel that's on the outside, that thin layer that's white to everyone, is different shades. Is different shades depending on the person. So we usually discern different shades of teeth by a color grid that we would usually call the chromoscopic or Vita shade guide, and it usually starts with A's, A1 to A4, all the way down to yeah, pretty much all the way down to D1 to D4, and a way to kind of help with removing some of these external stains, or what we call extrinsic stains, that would be layers of color development on the outside of the tooth. You can use whitening agents. You can use toothpaste that has kind of grit to it. But you can also just go in with your toothpaste, sprinkle some baking soda on there, and with the addition of the baking soda, which doesn't taste that great, the action of the baking soda is going to help remove those outside stains, and it's also going to have that little grittiness to kind of rub off some of that outside stain that is layering itself on top of the tooth. If you're really gangster, you can go ahead and throw some baking soda on your toothpaste and do a couple drops of hydrogen peroxide, the brown bottle that we usually use for cuts. And that hydrogen peroxide baking soda mixture is going to help break down the surface stains. It's going to help bring oxygen into your teeth that can help whiten the under layer, the dentin, the second layer of your tooth. And that can also help with managing day-to-day stains that you would usually accumulate from like coffee, tea, smoking ish, dark sodas, fruits that would have different stains. So there's ways to kind of take care of it. Does baking soda hurt the enamel? The baking soda doesn't hurt the enamel. It mainly comes down to like how what we were talking about earlier, which was what we were talking about earlier, which was how often, or sorry, how hard your toothbrush bristles are, how much pressure are you putting your on your teeth with your toothbrush. Those are more dangerous than just the baking soda on its own. But usually, like you might be saying, well, I heard something that if you rub all these gritty sandpaper like dust particles on your teeth, that it wears it down quicker. Usually what you guys have access to as far as like normal patients and civilians is not enough to be able to damage your teeth. Usually the stuff that the dental professionals have, such as polishing paste, pumice, all these stuff that have even different layers of grit. Like we have fine grit polishing paste, and then we have heavy grit polishing paste for those situations where we want to try to polish someone a little bit more, a little extra to remove that stubborn stain. That's where we can kind of make a little bit more selection. But typical baking soda, hydrogen peroxide, normal toothpaste, you should be fine right there as long as you have a nice soft toothbrush bristle and a decent to soft pressure. Oh yeah, I saw I got a message on my phone. No, let me check it. Cool. Don't worry. You are not bothering me. I'm a dental teacher. I'm a dental assistant teacher. This is all I ever get, and it doesn't bother me. This is my passion. You're all good. If it sounds like my voice is getting worse and worse, then at one point I'll probably call it. How often are dentists recommending unnecessary stuff to make some money? Ooh, this is a fun one. Let's get into that one, but let me ask see this one. But no, it's good to kind of get all this information, because who else would willingly be able to want to talk about kind of the background to dental stuff unless you're actually at the dental office, and they barely even want to talk to you anyways when they're there. So you could find a dental professional online, for some reason playing Minecraft at 11:55 Pacific Standard Time, and they're willing to talk. Get your money out of it, right? Get asking questions, and thankfully I like doing that. How often are they recommending unnecessary treatment? Medical field and dental field is very... Looks like it's nearing 12 a.m. for you. Yeah, exactly, right? Medical and dental professionals, specifically the people that can make those calls, the dentists and the medical doctors. A lot of their stuff that they are trying to recommend for patients are based off of what they learned from their schooling. So whether you're East Coast, East Coast, West Coast, or somewhere in the middle, whatever you went to school, their standard way of teaching you to either be a conservative dentist or a liberal dentist on as far as how your treatment plans come about definitely is something that can be changed, or that can be seen from state to state. And when it comes to what type of dentist you'd want to find yourself at, a lot of times I would want to be with a conservative dentist, where they're going to be a little bit more... They're going to have more of a watchful eye, like, oh, I see that something's developing there, but I don't want to do that filling yet unless it gets bigger. So they're kind of like warning you, hey, you got something developing, but I don't want to treat it until I actually see that you are not taking care of it yourself. Cool. Some dentists seeing that same type of x-ray and same type of image would be, same type of x-ray, same type of image would say, oh no, I see just a little bit of damage going on. I don't want to watch that. I just want to take care of it right now, so you don't have the risk of it getting worse. Are you in San Diego or just went to that college? I am not in San Diego, but San Diego is super far south of me, right? I'm more in the Northern California region. But yes, that's the main piece, main way that I'm... how the hell did I slay Jamie? I didn't slay you? That's weird. But yeah, I'm in more of the Northern California area, where I did go to vocational college to become a dental assistant and do all that fun stuff. So like how we're going about it, just depends on that doctor's educational eye on, do you see something that we would consider a watch? What branch of it are you going to go? Are you going to say, hey, let's just watch it and see if it gets worse? Or are we just going to take care of the problem and do the filling? So sometimes you can blame the educational background. On the opposite side, not really too opposite, it could also be the dentist's plan to try to recuperate and get as much money as they want. Now, we have some safeguards in place that would prevent a dentist from just saying, you need to go and take all your teeth out, get implants, get a bunch of dentures and fillings and everything. Definitely there are some dentists that want to line their pockets or their pockets, line their wallets with more cash if they're able to get it. But we have safeguards like insurance companies that go and do audits or do checks on offices just to make sure that what they're recommending and what they're doing is, for one, actually being done, and they're not performing fraud. Is the treatment necessary as it would be peer reviewed by other dentists of their same field, of their field, to say, oh yeah, that is necessary, we agree with what that doctor recommended and what they did. So we hope to catch all of them as often as we can, but of course there are going to be some that fall through the cracks. Our dental technology advance and older does dental technology advance and our older dentists falling behind, and probably always the best to get oh yeah, second opinions are also good. You can ask your dentist's office for a copy of your recent x-rays, and you can take that to another dentist and have a consultation, have a new exam with that second dentist to see if everything lines up. A lot of times, if you're in a good situation, everything lines up, or there's a very slight deviation where it was like that second dentist may say, oh, your first dentist said that you need a filling right here. If it was me, I do see what they're looking at, but I would probably just watch it and give it some time to develop to see if it truly becomes a cavity, or maybe if you got better at your toothbrush, your oral hygiene, flossing and everything, that you might even be able to stop it. So some dentists, when they go and kind of err on the side of caution of saying, let's see how it goes, I kind of like those people sometimes, versus the other ones that are just drill and fill. Those are the only two things I know: drill, fill, drill, fill. Does the technology in dentistry is advancing. There's especially like currently within the restorable area, especially for crowns, bridges, dentures, a lot of things are getting to the point where they can be CAD/CAM assisted and milled, meaning that a dentist can buy a $100,000 pieces of machinery that's going to make your crown in that office, glaze it, fire it, and you don't have to wait 2 weeks for it to be sent out to a dental lab and to come back. There we go. So there's areas like that where they're getting more and more they're able to do a lot more things by themselves without having to send things out to a dental lab. Not everyone wants to adopt that way, but that's one of them. These days, almost all offices tend to have a digital sensor for taking x-rays, but there are some of these old school dentists that do like the old film, traditional film style, and they operate with that. So it's not lost, it's just still progressing. It's still progressing as far as what they're doing, but dentistry in a whole doesn't look completely different, but you can see a lot more options for our patients now these days. Take it easy, Jamie. Yes, thank you for sticking around even though I wasn't able to play too much with you, but you're awesome. But there's a lot of things. 20 years ago, implants were a very selected few dentists that would go and place them. Now implants, damn near everyone, their cousin and their mother can place them. So it is an emerging field of technology, of access to skills to learn the technology and be able to perform it, and more, and especially more collaborative efforts from different areas of the dental field to make the end result good for your patient. what's the usual signs of a cavity? So when it comes to like visually, a cavity can look anywhere from a brown stain to a black mark to a cavitation. The word cavity doesn't exactly mean that you have a true caries or a tooth decay. A cavity truly is just like an empty place. Like you have a chest cavity, you have an empty hole like spot within your chest. But for a tooth, the street name is like, yeah, you got a cavity, or I have a cavity, whatever it is. So it's when you develop a cavity, you're developing a hollow space within your tooth because bacteria is now burrowing inside of your enamel into your layers to make it hollow on the inside. Signs that you would actually be able to feel a cavity happen could be things from such as thermal sensitivity, a little bit. Mainly sensitivity to sweets is a really big indicator to say, I bit down on chocolate, chocolate gave me zing, I got cavity. That's a really pretty easy one to figure out that you might either have a shallow cavity, a very not as deep one, to even having a full blown, yeah, you need to get this taken care of cavity. Is the cavity superficial? It depends. You can usually, if it's to the point where you can see it on the outside of the tooth, definitely, it hopefully is not too deep. But a lot of times when we're dealing with cavities in between the teeth, between the contacts or where we floss, that's where it gets difficult because you're not able to brush there. Mainly, the only way to take care of in between cavities is through flossing. And so even when you floss, a lot of times I'll just throw some mouthwash and hold it in my mouth, and I'll floss the mouthwash into the in-betweens of my teeth, or I'll use like toothpaste and I'll rub it on the floss and floss it in between, so I can get that fluoride action in between my teeth so I can get the benefits from it. So, and what the hell's a root canal, and why has my grandfather had a ton of them? Cool, let's talk about root canals. And a lot of these things, like I do need to make videos on how to explain them. So like, example, one of them that I'm in the midst of making for my channel is a what is a root canal for the patient's perspective. So if you reverse the word root canal, inside of your roots is going to be an empty space of that the nerves of your tooth and the blood supply is keeping the tooth alive. So when we do a root canal, we're going to drill a hole into your tooth. We're going to clean the inside of those roots so that the canal space is now empty. It is hollow, it's expanded and cleaned out a little bit more. It's disinfected, and that there's no bacteria, nervous tissue, anything in there anymore. Once we can clean out the inside of the tooth, which is essentially killing it, now that it is fully cleaned out, we have the potential to fill it up with a rubber-like filling material that we call gutta percha. With gutta percha, it's like essentially like it's like corking a wine bottle so that nothing can get out, nothing can come in. And when we cork a tooth with gutta percha, that makes it so that since nothing can get in or out, you could potentially keep this tooth for a good long while without it breaking, hopefully, and definitely without it reinfecting, hopefully. So are those root canals drilled deeper than cavities? Yes. Essentially, think of a cavity where, like, let's say a cavity would take like 45 minutes of time, maybe 30 minutes if your doctor's pretty quick. A typical root canal on a tooth, if it's in the front teeth, which has a single root, which means it has a single canal, it would usually take about 1 hour to be able to do the full thing. And for every extra canal that is added to that equation, usually you're adding another 30 to 45 minutes. So like a molar, which would usually either on the top have 3 or on the bottom have 4 canals but 2 roots, you're looking at a 2 to 3 hour procedure just to clean out a very delicate space that's inside that tooth without breaking it. So it's harder than it actually sounds, because your doctor is sitting in there with a file, and they're just constantly just moving their hand file, and just hand manipulating a piece of hand manipulating a this file to clean the inside and outside. And you'll see dentists, they'll just be looking up at the ceiling, and they're just using their hand movements and their feels to be able to clean a root out. So it's a long procedure, definitely, with a lot of irrigation, a lot of cleaning out, a lot of rinsing, a lot of drilling, a lot of cleaning out, reshaping, gutta percha, all that stuff. Do you need to be numbed for for a cavity treatment? Some people try to get by and say like, "Oh, can I not get not get a anesthetic? Can I not be numbed? Can I not need the shot for this?" A lot of times we say no, because if we start drilling into your tooth and you get that sudden, usually really dependable burst of pain, where it's like, oh, I felt that. Just that movement of just kicking yourself back or twisting your head one way or the other because of that pain can cause issues where that drill that's doing the drilling may get either pushed down or pushed out to the side or digs into the cheek because they move so violently that now we potentially have caused more damage than it would have been to just numb the person and them not feel any of that portion. Hey, you take it easy, Thrasher. Thank you for the questions and testing my mind and everything. You have a good time eating. I'm gonna go to sleep and rest my voice, and maybe we'll see you next time, hopefully. But you know where to find me, somehow in the nighttime or around this time on stream. But you take it easy, man. I am heading off on my own too.